Celiac disease is a genetic autoimmune-mediated disorder that causes damage to the small intestine. This is why it's crucial for people who may be experiencing potential symptoms to receive a formal diagnosis from a physician. But receiving an accurate diagnosis isn't always simple. Celiac disease can lead to many different signs and symptoms. These differences can make it challenging to receive a prompt and accurate diagnosis. Partially for this reason, up to 4 out of 5 individuals with celiac disease live their lives without a diagnosis or with a misdiagnosis of the wrong medical condition. Left untreated, celiac disease can lead to complications that include other autoimmune and neurological disorders, heart disease, osteoporosis, infertility, and even certain types of cancer. Receiving a formal diagnosis of celiac disease involves a multi-step approach. Prior to reducing gluten consumption, a person experiencing symptoms of the condition should raise their concerns with a physician. Their physician should first order serology testing for antibodies present related to celiac disease, most commonly to tissue transglutaminase, or TTG. Depending on the results of the serology testing and other risk factors, the doctor may suggest an upper endoscopy, which is a procedure to examine the lining of the upper digestive tract to assess the degree of intestinal injury related to celiac disease.
Having a confirmed diagnosis of celiac disease is important for a couple of reasons. First and foremost, you want to have the correct diagnosis so that you are treated correctly and you start to feel better. It's important that if you have celiac disease that your doctor also tests and monitors you for other autoimmune conditions. It's also important for you to have the formal diagnosis, as celiac disease runs in families, and so other members of your family may need to be tested. And finally, a formal diagnosis may help with access to other things that you need as a patient with celiac disease, such as access to a dietitian or help with certain medical costs for procedures.
Incredibly important to be able to eliminate gluten from the diet if you have celiac disease in order to prevent some of these short-term and long-term complications. A few examples: anemia, bone disease, osteoporosis, osteopenia, liver disease. There can be a skin rash called dermatitis herpetiformis, vitamin and mineral deficiencies, and then a host of gastrointestinal symptoms such as diarrhea, constipation, gas, bloating, as well as reflux. It can also lead ultimately to cancer in rare cases.